My name is Santokh. I'm a clinical pharmacist. I currently work for GP practices. My role involves giving healthcare and medicines advice to my healthcare team, to our patients and our carers. I also am a volunteer for Nishkam Healthcare Trust, where I help support with health screening and giving medicines advice and healthcare advice to our local community. So vaccines are also known as immunizations. These are important because they help our immune system build resistance to diseases before we even come into contact with them. They can be given as injections into the arm, into the thigh. They may even be given as a nasal spray or drops into the mouth. Vaccines are important in reducing serious infections and even saving lives. Some of these infections are so serious that they can make children and babies very unwell and in some cases even cause death. Vaccines are very safe and very effective. All vaccines go through lots of testing before they are actually used in any people, whether they're adults or children or babies. They're also regularly monitored across the world as well as nationally for side effects and any safety issues, and that learning is shared to make sure that vaccines remain safe and effective. Vaccines can have side effects, but they are usually quite mild. So for example, you might feel some soreness or have some swelling at the site that you've had the injection. You may have a headache or a light fever or some mild flu-like symptoms. But these usually clear up after a few days. It's very rare to get any serious side effects. It's also rare to get any sort of allergic reaction. If anyone did have an allergic reaction, the person that's giving you the injection is trained to actually deal with that allergic reaction as well. So measles is a good example of a vaccination that's really quite important in children and for mothers. Having a measles infection can cause complications. For example, in children, we may see complications such as pneumonia, which is a horrible infection that affects the lungs and could lead to a hospital admission. Also brain swelling and even blindness. In mothers who may get measles, they may have complications for the unborn child, for example, low birth weight, even miscarriage or stillbirth. I would say that it's really important to get vaccinated. So if your child or your baby, or if you are a mum-to-be, it's really important to talk to your GP practice and find out how you can get vaccinated and protect yourself and your children and your children-to-be.